Pertussis, otherwise known as whooping cough, is a bacterial disease that mainly affects children and is characterized by convulsive coughs, which is followed by a whoop, hence the name whooping cough. The whooping cough is a organism called Bordetella pertussis, which is a bacterium type of type of organism. So, whooping cough is not cultured or isolated because it has been very unsuccessful. They have done swabs and they've used charcoal horse blood agar to transport and culture, and they've even done the inclusion of a cephalexin as a selective agent. But even though they have done these, it allows them to see the early stages of disease, but again, it has not been successful in culturing and isolating it. So, whooping cough is acquired by mainly sneezing and coughing. So, when a person sneezes or coughs, tiny germ laden droplets are sprayed into the air and breathed into the lungs of anyone nearby, and that is how it is acquired, by breathing in that cough or sneeze that people have done. What's the cause of the disease? It's Bordetella pertussis. It's the bacteria, as stated before. So this bacteria will attach to the cella, which is tiny hair-like extensions that line part of your respiratory system, the upper respiratory system. The bacteria will then release toxins, poisons, which will then damage the cilia and causes airway to swell. And this was all according to the CDC. So, signs and symptoms. These signs and symptoms usually take about 7 to 10 days to appear. So it's really hard to catch it early. It's a sign of runny nose, nasal congestion, red and watery eyes, and fever and cough. And after it hits the 2-week mark, if left untreated, it can turn into vomiting, your face will turn red or blue, you're struggling to breathe, and then when you cough, it has that whooping sound that you make, hence why the term whooping cough is also usually notified into this disease. How people make the diagnosis of the disease. So they have to ask the history of any typical signs and symptoms. They'll do a physical examination. They'll do a laboratory test and a blood test. When they do a laboratory test, it will involve them taking a sample of the mucus, which they will get with either a swab or a syringe filled with saline, and it will come from the back of the throat through the nose. Treatment. So early treatment is key. The quicker they find it, the quicker that they can they can help prevent it. Antibiotics is the main treatment for whooping cough. And the early treatment is key because then they can help spread the disease from anybody who is in close contact of you. If left untreated after 3 weeks of having this bacteria in your system, any antibiotics is unlikely to help you because the bacteria has already done damage to your body. So once you are on antibiotics, there's the at-home treatment to make yourself feel better, stay safe, healthy. You need to follow an antibiotic schedule. You need to keep your home free of any type of smoke, dust, chemical fumes, something that won't let you breathe properly. Getting a vaporizer will help you get the moisture out of the air. You need to practice good hand washing techniques. Plenty of fluids, juice, Pedialyte. You cannot be dehydrated. If you are dehydrated, you need to contact your doctor immediately. And you need small meals every few hours to make sure that you do not vomit. How can you prevent whooping cough? So the whooping cough is recommended to get a vaccine called Pertussis vaccine, which is 2 types of vaccinations, which is diphtheria and tetanus. While it is recommended to be given in infancy, side effects will include mild fever, crankiness, headache, fatigue, and soreness at the site of the injection. It is a 5-series shot. You will get one at 2 months old, 4 months old, 6 months old, 15 to 18 months old, and 4 to 6 years old. And these are my references for the Bordetella, Pertussis, and whooping cough. If you guys have any questions, please let me know.